Today we're going to be discussing the phases of healing and rehab. So on day one, you have the injury. The injury first occurs. So then when we get to stage one, that's going to be day 4 through day 6. This is going to be the acute or inflammatory stage. During this stage, you're going to experience swelling, redness, heat, pain, and loss of function.
Like a little bit of moving.
This is also when the clotting formation begins. Stage 2 is going to be days 6 through 21. This is the healing / repairing stage of it. On day 14, notably, the fibroblasts begin to lay down immature fibers. When we get to stage 3, that's day 21. This is when the collagen matures. It's going to be like concrete hardening inside that affected extremity.
Oh, good. I'm glad you want to.
So now we're going to get to rehab.
Great.
And the first stage is going to be max protection. So during this max protection stage, you're going to be able to do passive range of motion. You want to make sure that they're able to keep the range of motion that they have at the moment. Then you're going to get to the Price principle, which is protect, rest, ice, compress, and elevate. Stretching is not a good idea. You definitely don't want to stretch affected injury during this max protect.
You say a lot of good things that are like good sound bites for that.
You are able to do low intensity isometric exercises, which is encouraged to help decrease pain. And then massage and modalities exercises will also help decrease pain and swelling. Then you're going to get over to the mod protections. So during this one, we encourage normal activity. We encourage you to manage pain, but do not push through the pain. This is when you're going to begin active exercises. So during these active exercises, make sure you're not pushing through pain. If you feel pain, make sure you guys communicate it and have to stop that activity. But some of these active exercises, active range of motion, muscle endurance, protected with bearing, this is when you are allowed to stretch, and it is encouraged to stretch. You want to warm up the affected tissue, whether that be hot towels, a hot bath, hot showers. Joint mobilization and relaxation. Then we're going to get over to the return to function. This is when
super lazy and tight on the
educate the patient, letting them know what they